Welcome, everybody, and Happy New Year. We start a new year, and I'm happy to be here with you. Thanks for joining. This is a webinar I think you'll find to be very interesting and very exciting, and has tremendous application for the chiropractic profession and for other professions as well. This really there's some real game-changing things that are happening in the world of Alzheimer's disease that I want to share with you. This topic that I chose is alerting patients to leading edge Alzheimer's screening and treatment options. And I'm going to highlight where chiropractors have a very important role to play, which is becoming very evident by the literature and by certain organizations who are seeing where chiropractors can play a role. So let's get started because we have a lot to cover in the hour. The major topics that I want to cover, including looking at Alzheimer's trends and forecast of new incidents that we're facing, which is quite dire, actually, and ominous. Well, I'll review the three major pathological findings in Alzheimer's disease, the current medical state of treatment, why it's become very outdated. We'll look at the new emerging clinical approach to Alzheimer's disease with respect to risk assessment, early detection, effective treatments, and prevention strategies. And chiropractors can play a role here that's important. So in that area, we'll look at genetic risk factors, new retinal scans that are available, new brain scans that are available, these PET-specific brain scans, new blood tests, newly approved drugs. That's why the medical community is excited, because there are some new drugs on the horizon that look promising. But we're going to look at how dietary factors and other lifestyle factors have been shown to modulate Alzheimer's disease risk. And the same is true for supplements, where they can play a role in prevention and reversing early to moderate stage dementias. I'll show you the research. The emerging new role of optometrists, we'll talk about that, and the role that chiropractors can play, and other holistic practitioners as well. But chiropractors, being such a large group of health professionals, the second eyes in the healthcare system, as I'd like to say about the profession, can play a huge role. And I'll tell you about these new private clinics that are going to be opening called the Clear Brain Institute, and the services they offer. These are private clinics, but they're going to play a major role, I think, in helping to sort of stem the tide in Alzheimer's disease development and improve treatment, especially in the early stages. So let's get started. Let's look at the stats on this. You already know there's this huge wave of Alzheimer's disease that's happening as the population ages. In the United States, it continues to be the fifth leading cause of death among Americans over the age of 65. And in the last 20 years, deaths from stroke and heart disease and HIV have decreased. Deaths from Alzheimer's disease has increased by 145%. And they're saying, 1 in 6 people over the age of 65, over the age of 80, now has Alzheimer's disease. So living longer is one thing, but if you're going to be faced with your brain undergoing decay, it's like, is there nothing that can be done about this? Up until recently, there was nothing that could be done, but things are changing. The Alzheimer's Society says that 40% of people just over the age of 65 already have some memory loss problems. In Canada, you look at 6% of people 75 to 79 have Alzheimer's, 12% of people 80 to 84. 25% of people over the age of 85. Certainly, there are things that we can do now. So the unspoken reality is this: that in modern times, there have been new interventions to treat cancer and cardiovascular disease, which are the leading causes of death. So people are now living longer. They're living long enough to enter the Alzheimer's risk age group. And up until very recently, there wasn't anything that could be done to really treat Alzheimer's disease or prevent it. And so, even though you're living longer, if you're in a, you've all known people that have gone through this where they just languish there in this state of dementia for sometimes for years. It's heartbreaking for the patient, for their family. It costs the healthcare system all kinds of money. And the reality is it doesn't have to be that way anymore. And you can play a role. So this review in Lancet really helps to highlight the story, showing that by the time dementia sets in, they're 20 years prior, there were already signs that things were going sideways. Beta amyloid plaque is building up, neurofibrillary tangles is increasing. There's some cognitive decline before you even start to have full clinical diagnosis. So medicine really starts getting interested here almost after the fact, as opposed to 20 years earlier, where things could really make a difference, as you're going to see. So let's just review the three major pathological findings in Alzheimer's disease. The first is that you run out of the memory chemical acetylcholine. The second is that beta amyloid plaque builds up extracellularly. And inside the brain cells, you develop neurofibrillary tangles. All three of these things need to be addressed. The first one is that you run out of acetylcholine. This is the cholinergic hypothesis, where the brain can no longer make optimal amounts of the memory chemical acetylcholine. So the drugs so far that have been available up till now are just drugs that slow down the breakdown of acetylcholine, but they're not effective in the long run. So you remember that I've covered this with you many times now, that to make acetylcholine, you need choline in the brain in the form of phosphatidylcholine. And in one simple step, the brain converts choline into acetylcholine. Notice that serine can become choline. That's why phosphatidylserine as a supplement is very helpful as well. But so the drugs right now that are used to treat Alzheimer's and dementia simply slow down the breakdown of acetylcholine, but they can't increase the synthesis of that. Only supplements can increase the synthesis of acetylcholine, as you're going to see. The second part of this, that's the cholinergic hypothesis. The second part of it is the buildup of beta amyloid plaque. So brain cells have these glycoprotein receptors on their surface, known as the amyloid precursor protein. And under normal conditions, they play a role in neuron growth and survival and repair of nerve cell damage. But in Alzheimer's disease, proteolytic enzymes chop it up and they form these beta amyloid plaque extracellularly, which generate free radicals, and they increase the development of neurofibrillary tangles, and they really wreak havoc in the brain in a significant way. So that's the second part of Alzheimer's. It's not just that you run out of the memory chemical acetylcholine, but beta amyloid plaque is building up. Then you have the development of neurofibrillary tangles, where the tau protein becomes hyperphosphorylated and it breaks down. So what does the tau protein normally do? The tau protein helps to stabilize the microtubules in the axons of the brain cells. So you recall that in the axon of the brain cell, you have these small little microtubules that are the little pipes, so that materials that are made in the cell body can travel down the axon to the end plate of the nerve cell. And those microtubules are held together by beams, these little blue beams that you see sticking up here. These blue beams are the tau protein. And in Alzheimer's disease, the tau protein breaks down, the microtubules fall apart, the tau protein coalesces into neurofibrillary tangles, and the nerve cell dies. So what causes the tau protein to break down? Well, a number of things can do that. You can, in early people who develop Alzheimer's disease before the age of 60, very often it's genetic. That's about 20% of cases or less. And often they simply have a strong genetic predisposition, where they inherited some genes that are mutated, that they inherited these genes, and it leads to the tau breakdown. So they have early onset Alzheimer's, like Pick's disease. But for typical late onset Alzheimer's disease that we typically see, having metabolic syndrome, where your blood sugar is high, your waist circumference is high, you have a low HDL, this also increases the development of tau protein hyperphosphorylation, neurofibrillary tangles. Also upregulating the mTOR pathway, being overweight. That's why intermittent fasting can be so helpful, having long periods between foods, so you raise your NAD levels in your brain, you shut down the mTOR pathway. That's important to prevent cancer, but also Alzheimer's disease. And then just having beta amyloid plaque building up in the brain increases tau protein development and brain injury. So, these football players who have these concussions and they end up with different types of dementias, it's not because they're building up plaque, it's because neurofibrillary tangles are developing. Even in the absence of plaque, they have neurofibrillary tangle development. And so, and if you have already neurofibrillary tangle development, it tends to spread from one cell to the next. So there's a number of things can increase the likelihood of the neurofibrillary tangle development. A lot of these things are under lifestyle control, as you noticed. The other thing that's happening is that you have whole brain atrophy happening over the age of 60. So the cerebral cortex, where you have executive function, is shrinking. The ventricles are enlarging. The hippocampus, where you consolidate short to long-term memory, is also undergoing major atrophy. A lot of this can be slowed down just by taking B vitamins at optimal dosages, as we'll talk about. Here it is on a scan showing the shrinkage of the cerebral cortex. You get personality changes, executive function is compromised, the ventricles enlarge, and the hippocampus is undergoing atrophy. These are telltale signs of an aging brain leading to dementia. So up until now, what medicine has done is they're like, doctors, wait until you're showing signs of dementia. And they do some neurocognitive testing. Yeah, we confirm you've got dementia, looks like Alzheimer's disease. We're going to give you drugs that slow down the breakdown of acetylcholine, these different drugs that help to raise acetylcholine. And they work a little bit, but eventually they don't work, and the disease progresses, and the patient dies either sooner or later, but they undergo some very progressive decline. Because these drugs are raising acetylcholine systemically, that you can get systemic signs of cholinergic syndrome, where you're getting slowing of the heart rate and gastrointestinal secretions to give you an upset stomach, tearing, salivation. All these things are a result of elevated acetylcholine across the circulation. So these drugs are working by slowing down the breakdown of acetylcholine, as I showed you earlier. Uh, it's the same way that if a person has depression and they're put on a selective serotonin reuptake inhibitor drug like Prozac, it's slowing down the breakdown of serotonin to try to raise brain levels of serotonin. So it's doing that. But only supplements and certain dietary strategies can actually raise the synthesis of acetylcholine, and that becomes important to the chiropractic intervention that we're going to talk about. There's about 20% of Alzheimer's disease that's actually misdiagnosed. A lot of this is where they do a PET scan of someone who has dementia. And they say, we don't see any bad amyloid plaque or neurofibrillary tangles. In many cases, these people have what's called late, which is limbic predominant age-related TD443 encephalopathy. It just simply means they have these misfolded proteins developing in the brain that are toxic to the parts of the limbic system. It's a very slowly progressive type of Alzheimer's. And this late condition can also coexist with Alzheimer's. So you can actually have both things happening at the same time. But in some of the cases, the misdiagnosed Alzheimer's disease clinically is because the person has just simply a B12 deficiency or a folic acid deficiency, or they have thyroid or endocrine problems, or depression that's sort of masquerading as Alzheimer's disease, or imaging of the brain, say MRIs are showing previous strokes, or the person has a brain tumor and it's producing these personality changes and memory loss. So in 20% of cases that are diagnosed as Alzheimer's disease just by neurologists clinically, sometimes there's something else happening behind the curtain that's been missed. So if the PET scan is negative for plaque and neurofibrillary tangles, very often you're seeing that the person really has late limbic predominant age-related TD443 encephalopathy, and that's really diagnosed on autopsy is the only way to really see it. And on autopsy, you actually see the infiltration of these misfolded proteins infiltrating. It's like certain areas here, you see it around the hippocampus. But just be aware that this is also can be a secondary factor in dementias as people age. There's no medical treatment for late, but the World Health Organization says, to help prevent late and manage it more effectively, all these lifestyle things are important. Being physically active, a healthy diet, don't drink alcohol, don't smoke, and manage high blood pressure, high cholesterol, depression, obesity, and diabetes. All these lifestyle things always come back into play as major modulating factors, and that you can play a role here, obviously. And whether you're a pro or anti-vaccine person, that's your business. But I will tell you, one of the vaccines that really shows tremendous promise for a number of reasons is the shingles vaccine. And that's because if you had chickenpox, of course, that virus stays living, in your nervous system, and it can be reactivated as you get older, and it increases neuroinflammation and beta amyloid plaque development. This recent study out of Wales shows convincingly, after they controlled for all their confounding variables, that older people that got the shingles vaccine following them for 7 to 9 years, a risk of dementia. If they already had mild cognitive impairment, it slowed it down. If they already had dementia, their lifespans were better and their quality of life was better. Because this virus does produce neuroinflammation and beta amyloid plaque development, it accelerates the process. And it's also linked, these viruses are also linked to making platelets stickier and blood vessel inflammation leading to cardiovascular disease. We've known that for a long time. So I would suggest that you consider this shingles vaccine as you get older. My mother had shingles when she was in her late 70s. It's really painful. A number of my friends have had it. A sports personality who was a a host, used to have me on his show all the time. You would know his name. I just don't want to mention it. He developed shingles about 2 years ago on the ophthalmic division of the trigeminal nerve. It affected his eye. It was absolutely horrible. And that vaccine has a very high success rate in preventing shingles. So I personally don't want shingles. I'm in a high risk age group. Let's talk about the emerging clinical approach to Alzheimer's disease. Risk assessment, early detection, effective treatment, and prevention. I want to read this slide to you because it really summarizes it. In the past few years, a seismic shift has occurred that's allowed practitioners, including chiropractors, to help identify patients who are at risk for Alzheimer's disease up to 20 years before the disease begins. Now, certain steps can be taken to prevent Alzheimer's disease onset, even in high-risk individuals. I'll show you who those high-risk individuals are and how to identify them. There are now new diagnostic tools that enable practitioners to identify amyloid plaque and neurofibrillary tangles many years before the onset of Alzheimer's disease symptoms occur. Previously, only a brain autopsy could confirm the presence of these pathologies. The person had to die first before you could actually confirm they had Alzheimer's. That's no longer the case. There are new drugs that have been approved by the FDA and in Canada that actually can remove plaque from the brain and slow the progression of Alzheimer's disease. So now there's this new heightened interest in all the strategies that can be helpful because now there's something that can be done. And diet, lifestyle, and targeted supplements are also shown to reduce risk of onset in high risk subjects. I'll show you the research and help reverse early to moderate dementia. I think this is important for chiropractors because we claim to be experts in the nervous system and we think about it, more structure function. But the brain is a big part of the nervous system. So counseling your patients on preserving their brain health as part of an extension of our neurological evaluation of the patient and interventions, I think it's something that we can cling to and be very effective at, as you'll see. So let's talk about genetic risk factors. The major genetic risk factor for Alzheimer's disease, of course, is the ApoE4 gene. If you have so you inherit one copy of the ApoE gene from your mother and one from your father. So you have these two alleles or two copies in your genes. If you have two ApoE4 genes, then your risk of Alzheimer's disease is 15 times higher. You have this homozygous form of ApoE4 than a person who has a different profile. And we know that the ApoE protein, remember where it is now. ApoE4 protein, the ApoE protein in its different forms, is part of the outer skin of your chylomicrons, your very low density lipoproteins, your LDL cholesterol. So it's helping to transport cholesterol and fats through the body, but it also acts as a signaling agent. And it has an effect on synaptic function in the brain and neuroplasticity and stabilizing microtubules, beta amyloid clearance. It's actually signaling a lot of different pathways. So if you look at ApoE4 statistics, 70% of all confirmed Alzheimer's disease patients have at least one copy of the ApoE4. That's why we know it's important. 25% of Caucasians have one copy, and they're 4 times more likely to develop Alzheimer's disease. That's 10 million Canadians and 80 million Americans. 2% of Caucasians have two copies of the ApoE4, giving them a 15 times greater risk of developing Alzheimer's disease. Now, in certain ethnic populations like Asians, the propensity is even higher, that the penetrance of that particular gene profile is even higher, so the risk is greater. So what does the ApoE gene do, or what does it look like? It comes in three different variants. So you can have either E2, E3, or E4. I don't know why there's no E1, but there's no E1. So with your contribution from your mother and your father, you have a different profile, different types of possible profiles. So you can be E2, E2, or E2, E3. That's the low risk profile. Or you can be E3, E3. That's a normal risk profile. But if you have just one E4 gene, that increases your risk of Alzheimer's 4 times. If you have both of your ApoEs or E4, that's 15 times greater risk of developing Alzheimer's disease. It doesn't mean you're going to develop it. It just means the risk is high. You need to be more vigilant in assessment and in the management of things to help prevent the disease. Now, until recently, there was no point in even having an ApoE4 test done for Alzheimer's because there was nothing you could do about it. But now with the paradigm shift of early detection, drug and lifestyle treatments, and different types of scans that can be put in place early before the disease even starts, now it makes great sense for everybody to have an ApoE4 test. The truth is only 1% of the North American population has had an ApoE4 test. I'm going to show you how to access it, why you should be recommending it. It's quite actually inexpensive. So the ApoE4, why this variant is the one that's associated with Alzheimer's disease, we think because it impairs lipid transport and cholesterol. It reduces the clearance of beta amyloid plaque. It increases neuroinflammation, and it damages the blood-brain barrier. So all these things are problematic. We've known for a long time that ApoE4 phenotype increases the risk of cardiovascular disease, leading to a greater risk of myocardial infarction and stroke. But you can now just a simple cheek swab test can now tell you what your ApoE profile is. For about $120, I think it's well worth it. And so this in this great communication called betterbrain.com, he lays out this fantastic little chart showing how the different combinations of ApoE are related to risk and the things that the outcomes that are likely to occur if you don't take some preventative steps. So that's the genetic risk. The second thing that's emerging is unbelievable is this company called Optina Diagnostics. They have this new retinal scan camera. So when you go to an optometrist very soon, it's part of the looking at the retina, which they look for macular degeneration and diabetic retinopathy and all these things that we've talked about for many years. But they can now, using this special type of camera with AI generated engine, show beta amyloid plaque. Remember that the retina is it's the back of the eye, but it's the front of the brain, right? So you can actually see plaque, and using the scaffolding technology built into the AI engine, it can show where the plaque is in the brain and the amount of plaque that's there. It's so highly effective at predicting who has plaque that it's FDA approved because it has over a 90% correlation rate with PET scans and MRIs. So this is a very non-invasive way to know how much plaque you have many years in advance of Alzheimer's development. So up until recently, we had what's called optimal coherence tomography. That's great. But now this company has enhanced that technology, showing where beta amyloid plaque is in the brain. This may one day replace the need even for a PET scan or an MRI, although you do need MRIs to rule out brain tumors and previous strokes. I think that's going to be around for a while. This is the new brain specific PET scan. So look at the small footprint that it takes up. This is like those you'd see a hair dryer in the hair salon back in the old days when your mother went to get her hair done and they put that thing down over her head. That's what it looks like. So it comes down over your head and it instantly does a PET scan. It's a brain specific PET scan. So there are different companies now like Positree and Oncovision that make these particular machines to take up a very small footprint. So it can be in a neurologist's office or in a private clinic, multidisciplinary clinic. These PET scans can be done, uses a little bit of radiation because it's actually, there's a glucose tracer that it's following. But the scan images are very, very diagnostic for showing plaque in the brain. So here you see a negative scan of the brain, and here you see plaque development in a positive scan. And so this tells you not only that you have plaque, but it tells you how much plaque you have. And if you're in the range of plaque formation that qualifies for the drugs to remove the plaque, in the United States, Medicare and Medicaid actually pay for the plaque to be removed because they want to try to curb this Alzheimer's trend that's devastating to the healthcare system and to patients and their families. So now the next thing is, until recently, to really confirm amyloid plaque and neurofibrillary tangles, you had to do a lumbar puncture to look at how much is in the cerebral spinal fluid. That's very invasive. But now there's an FDA approved blood biomarker blood test called the Lumipulse test. A simple blood test can now tell you how much beta amyloid plaque and neurofibrillary tangle you have. This test is available both in Canada and the United States. So if a person has even one ApoE4 gene upon the cheek swab test, then the Lumipulse test makes sense to look at how much plaque they have. And then that's followed up by probably a retinal scan to look for plaque in the back of the eye. And then possibly neurocognitive testing should be done, and then possibly a PET scan from there. So why the medical profession is excited, why drug companies are excited, is because there's now two approved monoclonal antibody drugs that can remove plaque from the brain that have been approved by the FDA, Kisunla and also Leqembi. And they remove beta amyloid plaque. So these drugs are on PET scan have shown pre and post PET scan that they can remove plaque from the brain. So they are now approved for people with early stage Alzheimer's disease or people with mild cognitive impairment. That's confirmed by a brain PET scan or lumbar puncture. But the brain PET scan is replacing lumbar puncture very soon. The person still needs to have an MRI to rule out brain tumors and past strokes. But these drugs, they don't stop Alzheimer's disease. They slow down the progression of the disease by 30%. So other things still have to happen. If you're just relying on the drugs alone, it's not good enough. Nutrition, lifestyle supplementation plays a huge role here, as you're going to see. Are these drugs approved in Canada as of October 2025? Leqembi has been approved by Health Canada. And what they're saying, and this is true, that if the person has two ApoE4 copies, right, they have the homozygous form, that if you give them those monoclonal antibody drugs, that particular in that genetic phenotype, there's an increased risk of brain swelling and brain bleeds with the drugs. So they're saying we're not sure this should be made available to these people, or there should be an informed consent thing, sort of in shared decision making with the doctor. I think they're still kind of working that out. But currency, in order to access Leqembi, you still have to have a brain PET scan or a lumbar puncture to confirm that you actually have enough plaque. So this would be an older patient. They're showing that neurocognitive test shows they're starting to struggle. And then they have a PET scan to see how much plaque is in the brain. If it meets the inclusion criteria, then they can get this drug provided. But look at the side effects of these drugs, right? One of the studies showed that in 16% of 12% of people, there's brain swelling from the drug and brain bleeds in 17% of people. So, you don't want to be rushing into these drugs if you don't need to. The idea is to help your patients avoid needing these things in the first place. But a lot of people would say, I've got plaque in my brain. I want you to remove it. Another point, of course, is that if a person's on anticoagulant drugs, the risk of brain bleeds is going to be greater for obvious reasons. Anyway, here's the research on that. But the medical community is very excited now because they can remove plaque from the brain. So with Leqembi, it's biweekly infusions. It's approved in the U.S. and in Canada. Look at in the United States what it costs by Medicare to pay for this. It's like over $26,000 a year. Plus, you have to have periodic PET scans to make sure there's no brain bleeds or brain swelling. So this is a very costly undertaking. In Canada, the drugs are approved, but the person pays out of pocket. But there are a lot of wealthy people who would be willing to pay to have the plaque removed from their brain. Just because I get it at an early stage, I get it removed, and I'm happy to have it removed. The younger I am, the less chance I'm probably going to have complications. So I understand that. And it's all sort of confirmed by this study in 2024 using functional MRI scans of the brain, where they are able to predict with 80% accuracy, years in advance, who's going to develop Alzheimer's disease 9 years later, just based on a functional MRI of the brain. So we can now predict who's at risk and who needs to be really aggressive in preventing the disease. So the question now is, how does diet and lifestyle factor into this? And so the body of evidence suggests very strongly that diet and lifestyle patterns, along with the use of targeted supplements, can significantly reduce the risk of Alzheimer's disease, even in high-risk individuals who have both copies of the ApoE gene, as I'm going to prove to you, and have been shown to reverse mild cognitive impairment and also early to moderate stage dementias if applied on a personalized basis. You need to do a personalized assessment. So in this section, we're going to review specific dietary constituents and patterns. We'll look at blood tests that are really important, that are influenced by diet and lifestyle to a large degree, the role of exercise, anthropometric assessment, blood pressure, alcohol, green tea, and other factors. So let's get down to it. So I just want to tell you, before I show you the evidence for this, I'm going to tell you, this is not me bragging, this is just me stating a fact, that over the years doing nutritional medicine consultations for a number of patients and helping other practitioners with the patients they have, I have personally reversed people that have mild cognitive impairment and even people with early and moderate stage dementia who are diagnosed with Alzheimer's disease. And I've brought them back to normal cognitive function and stabilized their conditions for 5 to 10 years. I'm talking about people now who are even in their mid to late 80s. This is unbelievable. So it sounds like I'm making up some story, but of course the details are in a previous webinar that I taught that you can see at this link. If you haven't seen this webinar on brain aging and nutritional medicine, you should watch it. It has a lot more details there. But I'm not the only one that's done it. This book, written by a neurologist named Dale Bredinson in the last couple of years, he published this book called The First Survivors of Alzheimer's Disease. And he talks about how he treated these people without drugs, using diet and lifestyle interventions and targeted supplements, the same ones that I have used. Now, in the book, he doesn't explain how the supplements work. I'm not sure he even understands how they work. But if you look at that webinar that I have recorded recently and made available to you, you'll understand the details of it. Here I'm hitting some of the highlights, but in that webinar, I really drilled down. But anyway, that's sort of the preamble to what I'm going to show you. So there's research showing that certain types of healthy diets, like the DASH diet, the Japanese diet, the Mediterranean diet, and people who follow these diets fairly consistently, they reduce the risk of Alzheimer's disease quite significantly. Let me show you the research on that. This is the Japanese diet. I like it. All these diets have certain things in common. It's not a surprise to you. More fruits, more vegetables, whole grains, decrease refined foods, refined carbohydrates, keep the high animal fats out. The Japanese diet contains soy products, which I happen to like. And you can see some of the studies showing the reduced risk of Alzheimer's disease associated with the Japanese diet. I think it's a great diet. There's also these health diets that have been promoted where they followed, 3,000 people and they gave them the similar types of things. And they're saying, try to keep the bad fats out and the processed meats out, the high animal fats out, and they have better cognitive function. And they included fish in this diet, which makes sense to me. And then there's the DASH diet. This is very similar to what I follow, actually, sort of a combination of the DASH diet, the Japanese diet, and the Mediterranean diet would be really what I do. But it has higher intakes of plant foods, fruits, vegetables, fish, poultry, whole grains, low-fat dairy, which I like, non-fat yogurt. I have that 3 or 4 times a week. Nuts, and minimizing red meat, sodium, sweets, sugar-sweetened vegetables. And these things have been shown to decrease risk of Alzheimer's. And of course, the Mediterranean diet, which gets a lot of the publicity, has a lot of the same things in common with sort of the style of eating. And several studies have shown a tremendous benefit in following the Mediterranean diet. And this really caught the attention of the medical community in 2025 because there was this huge study published in the journal Nature showing that when they followed 5,700 people for 34 years, and found that the more closely they adhered to the Mediterranean diet, they lowered their dementia risk by 35% in people who had 2 copies of the ApoE4 gene. The highest risk group, reducing the risk by 35%. So your genes don't have to be your destiny. That's the point. And diet and lifestyle play a key role. So does supplements, so does exercise, so does social interaction. We'll look at all these things. So what the researcher said is not only did following the baseline Mediterranean diet reduce probability in developing dementias by 35% in people with two copies of the ApoE4 gene, but higher adherence to the diet further reduced their risk. That's incredible. So this is a doctor from Women's Hospital and Harvard Medical School. That's major credibility. But I'm going to tell you right here in Toronto, we have a very this guy doesn't get the accolades he deserves. This is Dr. David Jenkins at the University of Toronto. He developed a portfolio diet. It's a similar diet, includes a lot of things, including soy foods, which I like, monounsaturated foods from like the Mediterranean diet, decrease saturated fat and cholesterol. His This diet has been proven to be very successful in reducing major adverse cardiovascular events. And I think it just sort of falls in line with the other dietary practices, but they all have a lot of things in common, as you can see. So when you're following that kind of a diet and you're exercising regularly, you get your blood biomarkers into the ideal range to prevent Alzheimer's disease. That's the outcome that you want. You want a total blood cholesterol that's no higher than 3.9 millimoles per liter, maximum 4.8 millimoles per liter. And that prevents not only dementia, but vascular dementia, which is the second most common type. You don't want to have clogged blood vessels in your brain. You have to have your total cholesterol down. In fact, LDL cholesterol is now considered an independent risk factor for the development of Alzheimer's disease. You need an LDL cholesterol that's below 2. In my view, it should be down around 1.5. And a fasting blood sugar below 5. You can't just wait till you're just not having pre-diet. You need a fasting blood glucose that's at 5 or lower, because as insulin levels build up, the same enzyme that breaks insulin down breaks beta amyloid plaque down. So if it's busy breaking down the insulin because your insulin's high, then the beta amyloid plaque is allowed to build up. Remain at your ideal body weight. Overweight individuals have a higher risk of Alzheimer's disease. Up to 81% of people living with Alzheimer's disease are estimated to have type 2 diabetes. I mean, how much more do you have to know than that? High blood sugar also impairs beta amyloid plaque clearance, as I mentioned on the previous slide. You also need a homocysteine down, ideally for healthy lifespan, under 8 micromoles per liter. How do you do that? You make sure you're getting folic acid, B12, and vitamin B6 at doses higher than you can get from food. That's the way you get these levels high enough to recycle homocysteine back to methionine. I've shown you this before, but you need a homocysteine level that's low. It also slows down the atrophy of the brain. Whole brain atrophy slows down when you get adequate amounts of the B vitamins, but you'll see that in a high potency multivitamin. You need a vitamin D level above 85 nanomoles per liter. We'll see that research later. You want a B12 level that's within the ideal range, and your red blood cell folate is important as well. You measure red blood cell folate because that gives you a 4-month understanding of your folic acid nutritional status. So numbers don't lie. These are my personal lab results from just a couple of months ago. I'm 71 years old. I don't take any drugs. I follow the dietary patterns that I sort of spoke about loosely. I exercise almost every single day. I keep my body fat down to about 12.5% maximum. And here are my blood findings after a 12 to 14-hour fast. My blood glucose well below 5, hemoglobin A1C. Look at my LDL cholesterol, my total cholesterol, LDL, HDL, the ratio. This is the lipoprotein little a. You should have this done once in your lifetime. It's under genetic control primarily. I was just happened to be fortunate that mine is in the ideal range. Triglycerides, homocysteine. I'm under 8, which is really important. Vitamin D level at 109, B12 level, folic acid. There's so much folic acid in my red blood cells. It goes beyond what the test can actually measure, which is actually a good thing. Low PSA level for prostate cancer, optimal kidney and liver and thyroid function. At 71 years, I'm very proud to have these numbers. I'm always nervous when I get my own blood work done, but this is a result of lifestyle intervention, I can assure you. Diet, supplements, and exercise. So what else you need to do to prevent Alzheimer's is these things you already know. Avoid brain damaging substances. Alcohol is on that list. Keep your brain active, learning new things. You need to build new neural circuits throughout your entire life. This is where Any eye-hand coordination thing comes in handy, where you're moving your body and you're learning a new skill, whether it's dancing or playing racket sports. There's some very good evidence showing that people who play racket sports have better longevity than people who jog or just lift weights or do swimming, uh, because these open skill exercises where it's engaging you're not just doing things in a rote way. When you're out for a run, it feels good, you're meditating. But when you're playing a racket sport, even pickleball, your brain is engaged in the game and you're having to anticipate. There's coordination, there's balance. Your brain is engaged and you're opening up new neural circuits. And studies show that it reduces cognitive decline. So it's one of the sports you can play that keeps your brain engaged. Avoid head injuries, of course. Keep your blood pressure normal. That shouldn't be a surprise. But even just participating in any endurance activity has been shown to help remove plaque from the brain and improve cognitive function. Some studies show that it decreases neurofibrillary tangle and beta amyloid deposition. And recently, strength training exercises, 2 times a week, 3 sets of 10 of the key exercises, using a resistance that's sort of at 80% of one repetition maximum. Just the standard things, bench press, lat pull downs, overhead press, seated cable rows, leg extension machine, hamstring, quad curls. Just 10 major exercises just twice a week has been shown in people that already have mild cognitive impairment to slow brain atrophy and improve their function. And of course, exercise helps to keep your body fat down and improve insulin sensitivity. But I think that's a given. Exercise is part of your understanding of prevention. And drinking green tea, we think it's very helpful because we think it can stimulate growth of new nerve cells in the hippocampus where you consolidate short-term into long-term memory. Let's talk about supplements while we have some time. Uh, a high potency multivitamin that has a B50 complex, 1,000 IUs of vitamin D, antioxidants. This is crucial because folic acid, B6, and B12 is the way that you recycle homocysteine back to methionine. At super physiological levels, it'll keep your homocysteine in the ideal range as it does for me. And it also slows down whole brain atrophy, as we saw in the Oxford memory study. So if you haven't seen that, go back and look at my previous webinar. But a recent study on B12 showed that Finnish men, for every picomolar increase in B12 they had, there was a 2% reduction in risk of developing Alzheimer's disease. That's not a surprise. And then vitamin 3 is equally as important in the form of nicotinamide, because it's been shown to have major neuroprotective effects. It even makes the microglia work more effectively to reduce beta amyloid plaque and neurofibrillary tangles. And it's a cofactor for these histone deacetylase enzymes that remove the acetyl tags from the tau protein so they don't form neurofibrillary tangles. So the nicotinamide is raising brain levels of NAD. And as you get older, your brain NAD levels decline. But giving yourself NAD injections or infusions or supplements, it doesn't work because NAD doesn't cross the blood-brain barrier. What crosses the blood-brain barrier that raises NAD is nicotinamide, vitamin B3, 50 milligrams a day that you get in the Adeeva multivitamin is already doing that. There's other precursors like nicotinamide ribose and nicotinamide mononucleotide that are showing promise as well. But look at the decline in NAD as you get older in the cerebral cortex. If you let this happen, you're in big trouble because NAD, as you see in this review in Cell Metabolism 220, 10 hallmarks of brain aging are directly related to NAD being present in the brain. As it declines, there's more oxidative stress. The brain can't make antioxidants. It can't prevent neurofibrillary tangles. It can't repair its mitochondria. It doesn't produce autophagy to take old cells out. It doesn't upregulate the function of the microglia. You're absolutely setting yourself up for a disaster. There are no drugs that raise NAD. This is all about supplementation. Also, studies show that oxidative stress is a big feature of Alzheimer's disease. Studies show that vitamin C and vitamin E cross the blood-brain barrier. I've shown you studies in the past where early-stage Alzheimer's patients are given vitamin E supplements at 1,000 to 2,000 IUs a day. It slows down the progression of Alzheimer's disease. Now, in 2022, the Cosmos Mind studies, they took these 2,000 plus adults who were 65 and older, who at the beginning of the study were dementia-free. They underwent neurocognitive testing for 3 years. The ones given just the daily multiple vitamin, it slowed their cognitive decline by 60%. Just a simple multivitamin can do that for reasons that I'm suggesting here, but you want a high potency multivitamin because you need also the vitamin D, right? Because vitamin D has been shown in animal studies to break down beta amyloid plaque. Low levels of vitamin D are associated with Alzheimer's disease. If your blood level is below 25 nanomoles per liter, there's a fourfold increase in cognitive impairment compared to people who have a vitamin D level above 75. So, you need supplements to do this in this part of the world. This is a fantastic review paper in 2019 in Trends in Neurosciences showing all the places where vitamin D plays a role in protecting the brain from neurocognitive decline and neurodegenerative diseases and supporting neurotransmitter function. It's just a great read. I mean, I can't spend too much time on it, but obviously this leads me to what I want to tell you, and that is if you're taking the Adeeva all-in-one multivitamin that has the B50 complex already built in with nicotinamide, folic acid, B12, B1, D thiamine is also important here, and B6. It has the 400 IUs of vitamin E, 1,000 milligrams of vitamin C, beta carotene, 1,000 IUs of vitamin D, bioflavin, everything from A to zinc in one formulation. You're familiar with it. I just got it reapproved by Health Canada. We got a new NPN. It is the most potent multivitamin that's sold in this country. The vitamin E is in the form of vitamin E succinate, which is the primary vitamin E form that has anti-cancer properties. I think that's important to mention, even though it's a bit off topic here. So that's the full scope of it if you need to review it. Also, essential fatty acids. You know the importance of omega-3 fats. I like fish, flaxseed, and borage seed oil together. I've explained why in the future. If you take 3 capsules a day of the Adeeva Nature's Essential Oils, you're getting the amount of EPA and DHA that are shown in epidemiological studies like the Framingham Heart study to be consistent with a reduction in Alzheimer's disease. If you just rely on eating fish only, you're running a risk of mercury toxicity according to the Environmental Protection Agency. I wouldn't have fish more than twice a week. And the mechanisms involved in omega-3 fats in the prevention are that, of course, it forms prostaglandin series 3, so it reduces inflammation and it dilates blood vessels, so there's blood is circulating better. There's less platelet adherence, so you don't have the stickiness of platelets causing mini strokes. It also increases the membrane fluidity of the nerve cell membrane, so electrical messages can move better. And it stimulates the LR1 receptor on brain cells that helps to inhibit the buildup of beta amyloid plaque, particularly DHA, that form of the omega-3 fat, docosahexaenoic acid. So it's critically important. This, of course, is nature's essential oils. I've talked about it many times. It does all these great things. It's core to brain health throughout all of adult life, in my view. Then there's melatonin, and you know that melatonin declines as you get older. It's not just about sleep, but it's also a brain antioxidant, modulates the immune system. It supports breast and prostate health. Low levels of melatonin are strongly linked to impaired cognitive function and Alzheimer's disease. Studies show that melatonin supplementation can reverse mild cognitive impairment and block the transition from mild cognitive impairment into Alzheimer's disease. So, of course, I like this combination of melatonin with 5-HTP, GABA, and bacopolonieri as a sleep product, but it also is protecting the brain in a number of ways. So, but here's the decline in melatonin as you get older. I've showed this to you before. Pay attention to it. You don't want to have this. You want to try to maintain more youthful levels of melatonin. It doesn't take that much, maybe 1 to 3 milligrams. That's all it requires. A review in 2020 showed that human clinical trials show that melatonin supplementation can reverse early stage memory loss in a significant percentage of cases. Melatonin supplements has been shown in imaging studies now to help maintain the volume of the hippocampus. That's where you consolidate short-term into long-term memory, and the lamina crebosa. That's in the part of the optic nerve, and as the lamina crebosa undergoes shrinking, the hippocampus shrinks at the same time. So it's a good sort of indirect marker, and it reduces the buildup of beta amyloid plaque accumulation. All in animal studies have shown this, but there are all kinds of human studies to show its value. So again, I like Adeeva Sleepy Naturals after the age of 40 because it not only has the melatonin, but it has the other things that help you get to sleep and maintain serotonin levels and consolidate short-term into long-term memory. Now, after age 55, of course, the brain can no longer access choline the way it could when you were younger because the transport system to get choline across from the blood into the brain is compromised. So the brain starts to run out of choline and phosphatidylcholine. You can't make acetylcholine to the same level. So with aging, less choline enters the brain. You get a decline in phosphatidylcholine and a decline in acetylcholine. That is well established in textbooks. And textbooks show this. This isn't some recent article. This is textbooks that already publish this information. So here's the transporter that brings choline from the plasma into the brain. And that transporter system, as you get older, starts to become more sluggish. You can't pump choline across nearly as well. So what do you do? Well, studies have shown that there are nutrients that help to get choline as you get older, can get choline across the blood-brain barrier and help to reconstitute phosphatidylcholine and increase the amount of the memory chemical. So what are those nutrients? CDP choline, phosphatidylserine, huperzine, and bacopimoneri. We'll talk about these in a moment. There are no food or drugs that can do this. Only these particular nutrients in supplement form after the age of 45 or 50 can make this happen. So what do these things do? Of course, the cell membrane is this biphospholipid layer, and phospholipids are, of course, a glycerol backbone. And then you have fatty acid chains, and then you have the phosphate group. This phosphate group needs to be choline or serine in order to make phosphatidylcholine or phosphatidylserine. And then the brain will use that choline to make acetylcholine. And the more of these side chains are docosahexaenoic acid, DHE, the faster the brain can make phosphatidylcholine if you give the brain the choline that it needs. So ultimately, you want to prevent the age-related loss in acetylcholine. Because in Alzheimer's disease and in dementias, there's a marked decrease in acetylcholine. You want to prevent that. So the best way to do it is by giving people, this is proven, by giving people CDP choline, a special type of choline. It's not in food, it's only in supplements. It's been proven to cross the blood-brain barrier and increase the synthesis of phosphatidylcholine. And from there, you can make all the acetylcholine that the brain needs for memory. So all these studies that I've showed you in the past where they've used CDP choline as a treatment for Alzheimer's, Parkinson's, age-related dementia to speed up concussion treatment, I've shown you this research before. Now here's what's new. In 2023 in the journal Aging and Disease, here's what the researchers said after looking at all the evidence. Researchers emphasized the importance of taking a daily supplement by age 50 or 55 that contains CDP choline, right? Because CDP choline is a natural agent found in all living cells. After ingesting it from a supplement, it's been shown to overcome the sluggish activity of the choline transporter in older individuals and very effectively increases brain levels of choline, acetylcholine, as proven by magnetic resonance spectroscopy. Right? It's not theory. In clinical practice, CDP choline supplementation has bolstered the memories of normal aged and elderly patients and has reversed early stage memory loss in patients with mild cognitive impairment and neurological diseases. The researchers say after age 50 or 55, you need to take it. And this is one of the studies they based it on, a study of 100 healthy men and women who had age-associated memory loss. They're 50 to 85 years old. After subjects got 500, that's an important number, 500 milligrams of CDP choline. For 12 weeks, the other half got the placebo. After 12 weeks, what do they see? The group that got the CDP choline, they already had memory loss. Significant improvement in episodic and composite memory, right? So recalling things from the past and also learning new skills. The researchers say should be standard treatment and prevention interventions for people in this age bracket. And then there's Huperzine A, this unbelievable 2021 review article, which I'll show you in a moment. They're saying, look, Huperzine A, which is a drug used in China for Alzheimer's disease, not a supplement, it's a drug that they use. But here it's a naturally occurring substance, so it can be put into supplements. It inhibits the breakdown of acetylcholine, so it works like the drugs do, right? The acetylcholinesterase inhibitor drugs. But it also inhibits the buildup of beta amyloid plaque and neurofibrillary tangles. It increases brain ATP energy, has neuroprotective effects, reduces brain-free radicals, increases the synthesis of the brain's own antioxidant enzymes, glutathione peroxidase, superoxide dismutase, catalase. It prevents mitochondria damage, decreases inflammatory cytokines in the brain, reduces brain cell damage even from iron, preventing what's called ferroptosis, which is brain cell death or cell death from too much iron. So here's the actual research study. I have it on my desk. It's unbelievable. You really need to read it with your own eyes. So studies show that even if you take mice and you genetically engineer them to have Alzheimer's disease, if you give half the mice huperzine A treatment throughout their life, it still preserves, it improves their working memory by almost 70% compared to the ones who don't get it. So even in these engineered Alzheimer's animal models, huperzine A is having a protective effect. Several human studies show improved cognition in patients suffering from dementia in both Alzheimer's disease and vascular dementia, administered huperzine A orally. And it's not just, subjective. They used objective neurocognitive tests to prove that memory is improving in these people. What dose do you need? About for therapeutic reasons, 200 micrograms a day, sometimes 400 micrograms a day. Here's a study in 2019, 50 Alzheimer's patients and 50 healthy patients prior to huperzine A supplementation. The Alzheimer's patients showed deficits in cognition and task switching ability. After 8 weeks, just 8 weeks of huperzine A supplementation, what do you see? Improvement in both of these outcomes in people that already have Alzheimer's. That's why I'm saying I've reversed some of these cases myself personally. A larger study published in 2002 involving 200 patients with mild to moderate Alzheimer's disease given 400 micrograms a day for 12 weeks, significantly improved their cognitive test scores compared to the placebo group. It goes on and on. Uh, and here's all I've read all these papers. It's just mind blowing to see all this. So in the past, Adeeva sold memory support complex. I was proud of it. It was sort of a preventative product. But now that this new research is so strongly confirmed by the literature and clinical trials, I revamped it. We got a new NPN from Health Canada. It's the strongest memory support product now in Canada. We changed the name to Cognitive Support Complex. And in just one capsule now, instead of getting 50 milligrams of CDP choline, you're getting all 500 milligrams in just one capsule. To huperzine A, I took it from 25 micrograms to 100 micrograms. For prevention, that's gold. That's 4 times more than had before. Bacopa stays the same. And phosphatidylserine, I had to reduce it a little bit because there was no room in the capsule the capsule was, I couldn't put it into the capsule size. So what I'm saying is that after the age of 45 or 50, latest 55, everybody, including you, should take one capsule of cognitive support. It'll get you all the choline that you need to protect yourself for the rest of your life. If the person already has mild cognitive impairment, early to moderate stage Alzheimer's, you give them 2 capsules a day. And that, along with the Adeeva multi, with essential fatty acids, with melatonin, lifestyle changes, get their blood parameters down, you're going to reverse a lot of dementias that already exist in the world. So here's some current references if you want to go and look at it. Here are all the references that you saw in the previous sort of footnotes on the lab studies and the lifestyle interventions. Another thing I want to point out is creatine as you get older, I think is very important, not just to support your muscle strength, but the brain uses creatine as well, has neuroprotective effects. It's been shown to improve memory in people who don't get a lot of creatine, like vegetarians, but also older subjects should probably take 1 teaspoon a day. That's about 5 grams a day. I do that personally. I put it into my protein shake. A systematic review in 2023 sort of said, yeah, creatine supplementation on memory performance in healthy adults is really showing tremendous consistency in the literature. I would suggest that you include creatine as well as lecithin capsules or choline bitartrate. Most people don't get the choline, just basic choline from food that they need. And a recent study in Finland showed that the higher the person's choline intake, this is a large study now of 2,500 Finnish men, showed that the higher the choline intake, the lower was the risk of dementia. And they also excelled in memory and linguistic abilities. And so the highest was sort of in this range. Remember, just taking one capsule now of cognitive support gives you 500 milligrams of CDP choline alone. So you're already well in excess of this. But I think getting some additional choline from food is very helpful because studies show that the people who got more of that choline, even if they had 2 ApoE4 copies, they had the homozygous form of ApoE4, that they also reduced the risk of Alzheimer's disease. It overcame the genetic risk just by getting more choline from dietary interventions. So I think this is an important thing to note. So I've given you in these slides, and I'll make sure you get these slides, where you can get choline from different types of healthy foods. It's very, very hard to get 450 to 500 milligrams a day. And as you get older, they're saying you might want to get closer to 1,000 milligrams a day. So one of the things that I have done is I buy Jameson lecithin capsules, these big monster 1,200 milligram capsules, and I take two of those a day. Each capsule has about 180 milligrams of pure choline, but has also other phospholipids. But I think you could also take choline bitartrate as a supplement. I'm looking at making that available as well very soon. So this is where supplementation fits into the program in my view. Throughout all adult life, to me, the Adeeva all-in-one multivitamin, nature's essential oils, and those lecithin capsules or choline bitartrate, I think you should recommend that to everybody. Beginning at age 40, I like the Adeeva Sleepy Naturals, not just to get melatonin, but to get other things that help the brain in a number of ways and to improve sleep quality and duration. I would add at age 40 creatine at 5 to 10 grams per day. That's 2 teaspoons or 2 scoops, if you will. And then beginning at age 50 or 55, I put them on a Diva Cognitive Support Complex. A great study in Lancet, which says, when it comes to Alzheimer's disease, we're seeing more and more that lifestyle factors really, really affect the biomarkers for these diseases, from smoking to high blood pressure. Education is important. Hearing loss is important. Hypertension, smoking, obesity, depression, physical inactivity, diabetes, alcohol. These are the things, traumatic brain injuries, these social isolation, these are the things that culminate and dovetail into the Alzheimer's profile. And they're saying, oh, by the way, make sure you got that LDL cholesterol under control and have a vision test. So this is the new role of optometrists now. Optometrists are going to bring those new cameras into their facilities where they can do this new type of retinal imaging and scan to look if there's already plaque in the brain. And if they see plaque, then they're going to probably recommend PET scans or the Lumipulse blood test and neurocognitive tests, sent to a facility that can do all that, including giving people nutritional medicine consultations and looking at key biomarkers. What's the role of chiropractors? Well, in Canada, 4.5 to 4.7 million Canadians see a chiropractor every year. And many of those patients are over the age of 45 years old. So looking at their family history, reviewing their recent blood work that they have them show it to you, and look at their total cholesterol, their LDL, their glucose, hemoglobin A1C, homocysteine, vitamin D, B12, folic. Look at what their parameters are and give them some feedback. Also on their anthropometric assessments, you should have a smart scale in your clinic. Look at their blood pressure, counsel them on alcohol, exercise, sleep, diet, wearing helmets. They can access a neurocognitive test at the Baycrest Hospital website. Make sure they get an eye exam, and that includes the Optina retinal camera. I'll be a resource for you to show where those are available. A hearing test is also important. The simple ApoE cheek test can be done very inexpensively, and I'll get you a resource for that. And the supplement regime, that supplements can do things drugs can't do yet. So the all-in-one multi nature's essential oils, sleepy natural, cognitive support complex with creatine and lecithin, it all fits into a clinical model of prevention, and you can play a huge role in imparting this information to the patients. I'm just going to tell you about the Clear Brain Institute. These are private clinics that are going to be rolling out in Canada, the United States. It's sort of everything under one roof. It'll offer the genetic cheek swab ApoE test, so you can access that remotely. The patients can do it at home and send the sample in. They'll have the Optina retinal scan, the Lumipulse blood test that'll look for presence of amyloid plaque and neurofibrillary tangles, neurocognitive testing, the brain specific PET scan. They'll be able to do the infusion drugs for people that meet the inclusion criteria. And they've appointed me to be their director of lifestyle medicine and longevity to do the nutritional medicine assessment and consultation. There'll be ongoing webinars and community-based engagement. And with my help, they've identified that chiropractors can be very important gatekeepers in their clinical and business model. So I'll report back on that in the very near future. So I want to thank you today for sitting in. I hope this was very helpful. I think it's a paradigm shift that we can all embrace, and I'm hoping that chiropractors will play a very key role in helping to stem the tide in Alzheimer's disease incidents and help people start reversing some of the early stage dementias with the natural interventions that we have. So thanks for sitting in. I greatly appreciate it. Of course, if you're not an Adeeva customer yet, you can access all this great stuff by just simply calling Arlene Walker or emailing her. Adeeva has a lot of free resources that can help you out understanding the monthly specials. And if you're interested in becoming a registered orthomolecular health practitioner, you'll be able to get that at that site. So let me just see if there are any questions that have come in, and I'll be happy to answer them. Looking at the chat box, I don't see anything. Okay, well, if anything comes in afterwards, you have a question afterwards, please just email me at adeeva.com. I'll be happy to try to get you an answer. Oh, here we go.
Dr. Machino, there's a question.
I don't think chiropractors in the US same. I'm not sure what that means. Same big role. I don't know why that would be. I think that they are able to do a lot of the same things that chiropractors in Canada could do, but maybe I'm missing something. But if I am, just email me why that would be the case. Certainly, I live in Canada, so I know what's going on here, and I think that we can play a big role. I mean, the brain is part of the nervous system. I know chiropractors have a huge interest in that. So hopefully, these interventions will make sense as we go forward. How do you manage your supplement intake? Well, I take quite a few supplements, and so if I was under the age of 40, I wouldn't be taking so many supplements. But as you get older, certain physiological changes occur in the body's aging clock, and so you have to counter them. So I just sort of spread them out over the course of the day. I have them with food, which is really the best way to absorb most of these things. And I'd rather be taking supplements than drugs. So even though it's a fair number of supplements to take each day. I rarely miss. I sometimes give myself a supplement day off once every couple of weeks just to clear things out of my system. I do that probably once every 2 weeks. I've been to chiropractor, but never did blood or any other health markers. Chiropractors don't necessarily order blood work, but if you've had blood work done, chiropractors can look at your blood work and see if you have uh, your biomarkers are in the ideal range for longevity. See, there's the medically accepted range for total cholesterol and LDL and homocysteine and vitamin D, for instance. But the ideal range for healthy lifespan, for healthy life expectancy, for longevity, for having a highly functioning brain and body for as long as possible, that's sometimes different than the medically accepted range. Your doctor can say, your blood glucose is okay. It's in the normal range. You're not a diabetic. You're not a pre-diabetic, but it may not be ideal for healthy life expectancy. So because I teach at the Chiropractic College in Toronto, I teach the students what are the ideal blood ranges for healthy life expectancy, for longevity, and maintaining a highly functioning body and mind for the longest period of time. And so I've taught chiropractors across this country and some in the United States how to look at that blood work so they can identify whether or not you're in the ideal range for longevity. And that's why I think chiropractors can play a very important role as the second set of eyes in the healthcare system around these topics. I've been to, okay. Well, all right. I think that wraps it up. Thanks
Dr.
for,
Machino,
yeah.
there's one more from Patrick Rooney. There's a question.
Oh, I didn't scroll down far enough. Sorry. Thanks, Dr. Grimmett. Always great to see you, man. I understand there's a drug under development that will actually manipulate and change the genetic genes. Well, so there are drugs that are in development that might be able to change your ApoE4 to ApoE2. How many years are we going to have to wait for that? We don't know. So yeah, it's very exciting, but I think if we hold our breath and wait for that to happen, a lot of people are going to be dead. So there are things we can do right now, and I think we have to get on with the business in front of us because we have an aging population. The wave of new Alzheimer's cases is going to escalate very, very quickly. We have an opportunity to stem the tide and do something meaningful. I'm going to tell you something. When I speak to the family out in Calgary, Alberta, It's an Indian family who contacted me about 8 or 9 years ago, maybe 10 years ago now, because their mother in their 80s was diagnosed with dementia. She had urinary incontinence, bowel incontinence, didn't know anybody anymore, totally confused. And he begged me to do a nutrition consultation. I said, I'm sorry, it's too late for her. I didn't think I could help. I said, I think it's too late. He said, listen, if it weren't too late, what would you do? I said, okay, listen, if you're willing to spend the money and pay me, I think you're throwing your money away, but I'll do. I did the consult. I looked at all her stuff. I gave them a really aggressive program. And within 3 months, her bowel and urinary incontinence was gone. And within 6 months, her total cognition was back. That was 8 or 9 years ago. She's still stable today. He calls me, every 6 months to talk to me about different things. And he's like, yeah, I don't know how to thank you. This is like a miracle that I witnessed in my own home. I'm like, well, so what doctor would have done that? I don't know a single neurologist that would have done that. So I'm very proud of that, and that's not the only case. And Dr. Bredenson now, who is a neurologist, is now confirming that the same literature that I'm reading, he's reading, and he has reversed cognitive decline in a great number of people. Is it going to work every time? I don't know. But the idea is now you can find these things much earlier, see who's at risk, and give people aggressive strategies to help prevent the disease. If they need drugs, they get the drugs. Okay.
There's a
I,
question, Dr. Machino,
yeah.
about supplements being available in the US.
Oh, our Adeeva supplements were available in the United States until the pandemic, and we ended up shutting down our Buffalo warehouse. But a lot of chiropractors in the United States had been dispensing them, and they would like to do it again. But now with the tariff war underway, everything's a bit on hold until that stabilizes, and then we'll look at making that available again. So that's really my answer. Yeah.
And
It,
Dr. Machino, there's a question about getting a copy of the webinar. So just let them know that we will be sending out the recording as along with your slides.
Thank you, Arlene. Yes, so I appreciate that. So when anyone who registered for this webinar will get a copy of these slides, and a recorded copy of the webinar will be available at a link that we will send you. So you
And
can,
it'll also be on the website
and
as
it'll
well.
be on the
Yeah.
Adeeva website and also at the website known as adevainfo.com. We'll have that probably within a few days. Have I missed anything else?
I think that's it.
That's it. Okay, everybody, get on with your day, see some patients, and go and help people. And I will see you again soon. Thanks so much for sitting in. I greatly appreciate it.